Leukemia is a word we all recognize, but a lack of real understanding has serious consequences. Consider this startling fact. Over half of all acute leukemia cases are discovered in the emergency room, and the person most likely diagnosed isn't a child. It's an adult between the ages of 65 and 74. So we have a disease that is often found by accident, at a point of crisis. Why is that? We'll show why it's so misunderstood, reveal the silent clues it leaves, and prove how education is a life-saving tool. First, we must understand what we're up against. Leukemia is not one single disease. It's a diverse group of cancers. It's classified by speed, acute for fast progression and chronic for slow, and by cell type, lymphocytic or myelogenous. This complexity is part of the diagnostic challenge. But the main reason it's missed is that its symptoms are masters of disguise. Think about this: fatigue, fever, weakness, and frequent infections. That sounds just like the flu. Body aches, easy bruising, shortness of breath. These are easily dismissed as stress or simply getting older. This mimicry is why people see their doctor multiple times before a blood test is ordered. This lost time can be devastating. So, if the obvious symptoms are misleading, are there any hidden clues? How can it be caught before it's an emergency? The answer is often found in routine data. Many chronic leukemias are discovered by accident during blood tests for other issues. The body does send microscopic signals. A complete blood count, a CBC, can show mild but persistent abnormalities in blood cells. Knowing to follow up on these subtle lab changes is a key piece of health literacy. It's the difference between an early and a late diagnosis, and catching it early is paramount. Research shows that patients diagnosed at an earlier point have significantly better prognoses. We've established the problem: a complex, stealthy disease. So what is the most powerful tool we have? It is knowledge. When patients understand their treatment, they stick to it. Education programs dramatically improve adherence to oral chemotherapy. Information replaces fear with control. Understanding your prognosis and options makes you an active partner in your own care. A leukemia diagnosis is emotionally devastating. Personalized health education is a proven way to reduce the anxiety that comes with it. There's a direct link. A clearer understanding leads to greater comfort and commitment to the treatment plan, improving outcomes. But today's treatment setting is more complex than ever, and grasping it requires unlearning what we think we know about cancer. Remember our question: how do you catch a silent disease? By creating an educated public that knows to ask, could it be something more? For example, asking, what stage is it, is often a trick question. Most leukemias don't have stages. They're systemic from day one. This is a fundamental concept for a new patient. Education here prevents this common misunderstanding from creating needless fear. Diagnosis itself has advanced. Next-generation sequencing can find specific genetic mutations driving the cancer for a personalized plan. This leads to targeted therapies and immunotherapies. These are not traditional chemo and require a well-educated patient to manage. This is where everything connects. We have a disease that starts with symptoms as common as the flu, but we now have targeted treatments. Accessible education is the bridge over that enormous gap. It helps a person get diagnosed sooner and manage these modern therapies. And this progress is real. A leukemia diagnosis is not the death sentence many fear. The 5-year survival rate is now over 60%. So, understanding leukemia isn't just an academic exercise. It's an act of empowerment and a source of hope. We've seen how education helps catch a silent disease, improves treatment adherence, and reduces the immense psychological burden. The fear that comes with a diagnosis is intense, but being armed with clear, credible information is the best defense against it. For patients, families, and the general public, improving our health literacy is a shared responsibility. Ask questions and find trusted sources. Because in the fight against a disease like leukemia, knowledge isn't just power, it's a direct part of the treatment itself.